So it's that team training that ensures a smooth transition to new protocols.
Good morning, Jackie Dorst. Thanks again for joining us. How are you?
Doing good today, Mike. It's nice to see all the dental offices getting back to reopening after closure, and they're all enjoying seeing their patients again. They can't give them a hug as they walk in, but
Right.
There's a smile behind that mask for them.
That's the worst thing about masks is you can't see the smiles, you know?
Yeah.
It's true.
But you can see the crinkles in the eyes.
That's exactly right. They smile with their eyes. Very good.
Yeah.
See, you would notice something like that. That's very good. How about aerosol mitigation in ortho offices? It can't be that big a deal, or is it?
Well, ortho offices don't use the volume of water that they do in the dental profession, in general dentist or even the other specialties, but they do use a little bit of water and they do generate some aerosols. The main procedures are when they're doing a bonding or a debond, because the adhesives that they use to glue on the brackets now, they're so secure that it doesn't just pop off with what is referred to as a bracket removing plier. Right now, they remove the bracket and then they'll actually use a burr in a high-speed handpiece to remove the extra adhesive that is left on the tooth, the residual adhesive. But however, very frequently the orthodontist does not even have water going through that handpiece. It's, you know, if you will, a dry, but it's still.
Will they have a couple of bays that are not dry and a bunch of bays that are dry, or is that
routinely? Before the SARS-CoV virus, no. It was an open bay, maybe anywhere from 5 to 10 chairs in one area, and they would do aerosol procedures at all of those chairs. Now that we're rethinking it, how can we reduce those aerosol procedures in the orthodontic office and maybe even repurpose another room, say a treatment coordinator's room or a records room, that's the room that we're doing those few aerosol generating procedures, such as when we're removing the adhesive from the tooth, either after a debond or before rebonding a bracket that has come off. So the AAO has actually listed all orthodontic procedures that would generate any aerosols or volumes of splatters and splashes, and that would need to be in that confined space, if you will, to mitigate those aerosols, either using high volume evacuation, which is going to take away about 90% of the aerosols, and maybe even a portable HEPA filtration unit in that area to improve the air exchanges per hour and remove the aerosols from the air. Then the other chairs in the open bay area can be used for those non-aerosol generating procedures. You know, aligners, Invisalign has become very popular in orthodontics, and routinely it's just a tray that you try in. Now, there are some situations where they'll put on what they call a button to increase the movement of one tooth or another, and they may need a handpiece, you know, again, to remove that adhesive. One of the orthodontic adhesive manufacturers has even developed a process that adhesive doesn't require air drying, which using the air water syringe, you can actually bond without having to have those splatters and splashes that come from pressing down on the air water syringe together to thoroughly rinse the tooth and then to dry it. So ortho's changing, as the rest of dentistry is, as we look at how can we successfully mitigate the aerosols and provide patient care and those beautiful, straight, sparkling smiles.
That's awesome. Beautiful, Jackie. Thank you so much. It was really good. Could you tell me a little bit about scheduling of patients when the patient comes back to a chair or an open bay? Is that open bay belong to a specific dental assistant, or is it like tables in a restaurant where they just go to the one that's available?
Most ortho offices now have an assistant works at a chair. Some other ortho offices, they move in between. You know, it's the patient looks, or the assistant looks, patient, you know, Mary Sue's here, I'm going to take her in chair 2. You know, so they will move around, but most of them have gotten so that the assistants are in a dedicated chair. But the goal for the orthodontic practice is to have all of those chairs set up universally, that they can move between. That's obviously the best dynamics. If one assistant happens to be out sick that day, then another assistant can move in. So standardizing the procedures improves efficiency.
Beautiful. And
yeah.
So that means all the chairs should be set up universally too. They probably should all have water if they need it, right? They should.
Yes, but again, they're rethinking that right now about having water there. Like I said, I've seen some of them even go to just a squeeze bottle of water so that they're not generating all of that aerosol spray with it, so that they can remove the adhesive, remove any debris if they've had to pumice the tooth, say, so that they can do a bond bracket with it.
Good stuff. And that's where I was going with that, is that I think a 2-liter bottle of water is going to last one of those open bays a week.
Oh, yeah. Oh, yeah. They don't use a lot. And then using the little portable, you may remember from your chemistry lab days, what's called a gooseneck bottle that you had in the chemistry lab, and you'd squeeze it and had a goosenecks on it in the water. They can use those, or a squeeze bottle, that they can just rinse the tooth with. And then they don't even need a basin. They can either use the HVE suction to suction out, or have a little cup that the patient could expectorate in and then discard that. So lots of possible modifications. It just requires a little thinking, and then for the whole team to hear the information at the same time, so that you don't have one assistant doing procedures one way and then another assistant goes, I don't do that. So it's that team training that ensures a smooth transition to new protocols.
And you're the queen of clean when it comes to that, right?
Yes, yes.
Awesome. Have you seen in ortho offices any tension between the dental assistants and the dentist, because the dentist wants to go back to work faster, and he's more interested in going quicker. They might be more interested in being cautious, or is that less of a concern in ortho offices?
And it's the same in ortho and dental offices. We're seeing a lot of pushback in dental offices from the dental hygienist.
Right.
And because the hygienists are exposed to the highest volume of aerosols. Right. Much more even than the dentist is. And the American Dental Hygiene Association came out with their own guidance for reopening. And aerosol generation was a consideration. Yes, I'm seeing that, and it's going to come back to training. So I'll work my way through it. I'm going to use an example of an ortho office where I'm getting pushback, and it all comes back to training, Mike. Offices that provided training the week before they opened, and they had practice sessions to put on all of that additional PPE and do the temperature checks, they had a smooth, soft opening, and the team felt confident. Offices that, received an email, we're going to start seeing patients on Monday, show up at 7 o'clock, and they were there, and here's your new N95, then that's where I'm getting that pushback and that apprehension and fear that maybe they're not fully protected and they're scared. So knowledge is that reassurance and insurance for them.
That's good. So training is team building a bit.
It is. Training is everybody knowing what their task is and how to do it. And then they're confident. And then the doctor doesn't get frustrated either, because they're scurrying around second guessing themselves. And when patients come in with questions and they're concerned, the team has the confident answers to answer those questions and reassure the patients, yes, we're doing everything to protect your safety at this time.
Thanks, Jackie. That's perfect. Let's do it again soon.
You're welcome, Mike. Thanks to ProEdge for all you do for the profession.